Hey, what's up, Feral and Voluntary Animals Corps? It's John Barr back again for another episode. This time we'll talk a little bit about lightning injuries, another important thing in the summer as we get all these thunderstorms. Here's our usual disclaimer. Please take a moment to read that. All right, so this time I'm going to tell you a little bit about strategies to prevent lightning-related injuries, and then we'll talk about the diagnosis and treatment of lightning-related injuries should they occur. Okay. So when should you be worried about this? So, the old saying goes, when thunder roars, go indoors, and that's generally good advice. And where are you going to prevent lightning injury? You need to be in a modern building or in a metal top vehicle. Those are the best places to go. So if you're working a special event and a thunderstorm breaks out, you want to get back in the vehicle or into a modern building, avoiding tall objects. If you are stuck and you have no choice but to stay in an open field, you want to space people out at least 20 feet apart to minimize the number of people, if there is a strike, who get hit. I'm going to show you a slide of the lightning position. That's really a last resort, sort of last ditch effort if you have no other option and you're stuck in a lightning storm in an open field. And if you are stuck in that situation, you want to take any metal objects off your bodies as they can cause significant burns. And I'll show you a photo of what that looks like. Other signs that lightning might be imminent, so you have when thunder roars, go indoors. But if you see one of these, it's like really imminent, like happening right now, and that's St. Elmo's fire. So St. Elmo's fire looks kind of like lightning, and you can see it was originally named by sailors on Navy ships when they saw these like what looked like electric glowing kind of things on the developing on the mast of the ship. They didn't know what it was, so they called it St. Elmo's fire. That's a sign of imminent lightning strike. If your hair stands up, you hear a crackling sound, or you smell that ozone-y kind of smell, you are at risk of imminent lightning strike, and you should get any metal off your body and get in the lightning position or get indoors because you're about to experience an imminent lightning strike. Now, what is that lightning position I just told you about? Essentially, it's crouched down, heels together, balls of your feet, cover your ears to try to reduce the risk of rupture of tympanic membrane. And if there is a vehicle or a building there, you're not going to delay going to that just to do this. The effectiveness has been debated in the literature. It may not be that effective based on a lot of studies, but it's the last ditch thing you have if you have no other choice. One of the other criticisms of this position is that it's hard to maintain for a long period of time. And if you're really stuck in a storm, you could have to stay like that for like 30 minutes or until it passes, which is quite difficult to do. But if you're stuck in an open field, you have no building, no car, no hope of getting to one, and no other alternative option, this is your method of last resort to reduce the risk of lightning injury. So what are the clinical findings? So if you look at this photo here, this is like a classic um, finding from lightning injury called the Lichtenberg figure. It almost looks like lightning, and that's pathognomonic, meaning if you see this, this is really only caused by lightning strike. Now, there are a lot of cardiovascular findings, so you're going to have to request ALS and look at the EKG, but you can have these EKG findings you see here: ST elevation, QT prolongation, and AFib. You can develop a cardiomyopathy from lightning strike. And then neurologically, so these patients can be quite unstable because they can get brain bleeds, they can get seizures, they can get autonomic instability, meaning their vital signs could be kind of wacky. SIDH you're not going to really know about until in the hospital until later, but again, that's a manifestation of the neurologic injury that can occur from lightning. And then they can have burns, which you can see. So there can be linear burns from sweat vaporization and flashover, as well as the tiptoe sign, which is a type of like exit burn. I'll show you a picture of that. That's also pathognomonic for lightning. Not much else causes that. And you can have burns from heated metal and melted fabrics. So what does that look like? You can see on this kind of synthetic underwear here, kind of melted. And you can see over here, there is a burn from a headphone wire that this patient was wearing. And so that was a metal object that led to those burns. I mentioned that tiptoe sign. These are the exit of electricity. You can see them here on this foot here, and it actually just kind of blew out the sneaker in this case. Okay, so let's talk about, if there is a lightning strike and there's subsequently a mass casualty, what do you do? So this is that classic kind of, you know, board question or test question, like, oh, you reverse triage in a lightning. And yeah, but it's not truly reverse triage. It just means treat the cardiac arrest first, like a red. And then you're going to treat the rest of the reds, yellows, greens in the usual order. That's because the mortality from cardiac arrest is lower in this population, so you have a better chance of saving them. Part of it is due to electrical injury and rhythm disturbances, but part of it is also due to paralysis of the diaphragm from the electric. And so by doing rescue breaths, you can kind of correct that, and you have a better chance of surviving cardiac arrest in this situation. Some people wonder, well, oh, can I touch the patient? Am I going to get shocked? No, you are not. There's no residual charge. You should be aware, though, that if there's still a storm going on, you could still be struck by lightning, and that's important to get out of that situation. So getting out into the ambulance is a good way to deal with that. That way you're not at risk of free strike. Okay. This slide has some more advanced stuff for in-hospital and ED evaluation of lightning-related injuries. I really only show it here in case you're interested, and also to show that these patients need to go to the hospital because they need a significant amount of workup. This is a no-brainer transport to the hospital. So, like I said, all lightning injuries, even if they seem minor, should be transported. There are some people in the literature that maybe some low-risk patients can be discharged from the ER, but that's pretty controversial. I would not do that. Right now, I would say all these patients, from your perspective in EMS, need to go to the hospital, and they need to be monitored on a cardiac monitor for probably at least 24 hours due to, again, those cardiac disturbances on the EKG. And some sources suggest even longer monitoring, up to 3 to 14 days, you can get arrhythmia after a lightning strike. And I think that's just important for you to understand that if you respond to a call for someone who says, oh, I got struck by lightning 14 days ago, they might still be in that window where they could have an arrhythmia, and so you should take that seriously. You shouldn't think, oh, it was 14 days ago, it's not a big deal anymore. It still actually can be a big deal. So that's good for like a callback if someone like went to the hospital, they got discharged maybe 10 days later and they're not feeling so hot, just know that they're still at risk. And those are some references I've got here if you want to check it out. Otherwise, stay safe out there, guys. Take care.